Hey guys, Dr. Jeff Finley here. This month we are talking heart health. Whether that be physical or emotional, we want to make sure that your heart is where it needs to be. This week we are looking at a paper that came out talking about the risk of heart attack with NSAID use, or over-the-counter pain pills. Let's take a look. NSAIDs are one of the top things that MDs prescribe, and certainly one of the things that most of us go to and grab when we're in pain. But is this the best option? Well, according to the research article, not necessarily. To put it into perspective, this research article took a combination of articles totaling almost 500,000 people. Thus, the amount of people taken into account really helped make the statements apply to a broad range of people. What they found is that any use of NSAIDs increase your risk for heart attack. So to quote the paper, with use for 1 to 7 days, the probability of increased myocardial infarction or heart attack risk was 92% for Celebrex, 97% for ibuprofen, and 99% for naproxen. In other words, your risk with taking these for 1 to 7 days is anywhere from 92 to 99% increased. They also stated taking any dose of NSAIDs for 1 week, 1 month, or more than a month was associated with an increased risk of myocardial infarction. The higher the dose, the greater the risk seen. Yikes. Now, does this mean that we should never take them? Not at all. There is certainly a time and a place for medication. However, what if there was a much safer option with less risk of side effects or more sinister issues? Can you guess what that may be? Chiropractic, of course. Chiropractic is one of the most well-documented therapies for pain and is documented as one of the safest options. In fact, one of the more common risks with chiropractic care is simply soreness. I don't know about you, but I like that being the biggest risk. Unfortunately, only about 10 to 15% of people actually use chiropractic. And while this is getting better, on an average day in a medical doctor's office, only about 10% of patients with pain will be given a chiropractic referral. More recently, the Surgeon General now advises chiropractic care as a safe alternative to help manage pain over any opioid use. And with the opioid crisis this country has, it's nice to see that science is finally catching up to support a solution. So the next time you feel a little achy or a little soreness, you may want to consider alternative treatments. Now, as always, guys, this information is for educational purposes only. You should always consult your doctor on alternative treatments or solutions for your issues. As always, thanks for tuning in, and we'll talk to you guys next week.